Today we're going to be talking about tendinopathy or tendon inflammation, tendon pathology. A lot of times happens mainly from repetitive use. It can happen from an overstrain, like overworking it. But what is it exactly? The difference between healthy tendon and tendinopathy is basically the fact that the tendon is inflamed and it's going through an immune response to help it repair. And so what we see is that here, normal healthy, we have densely packed collagen type 1 fibers, which are really stiff and tight. And over here, we start getting what's capillary ingrowth, ground substance, unevenly distributed fibroblasts now, and different types of collagen. Now, why is that? Well, because the immune system is starting to kick in there and trying to repair the area. But typically, people's everyday activities are creating more damage, and so the body's trying to keep up with it. One of the biggest things about helping out with tendinopathy, especially if it's really bad, would be additional therapy. But some of the best things for it simply are eccentric contraction. Tendons do better with consistent load and not quick load that's been happening for a long period of time. So repetitive motion, that's not great. And then jerking motion, like lifting heavy weights, not good. What you do need is to help reset and help strengthen the tendon, and this is also for ligaments, is that you need eccentric contraction, which is an elongation contraction. So if you have biceps tendonitis, you want to slowly release weights down to fully extended bicep. This is a shortening of the bicep, this is extending. And then you reset and you're doing a set of, say, 3 sets of 10 like this daily, and in order to help stimulate the reorganization of the fibers of the tendon. Additionally, if it's inflamed, really irritated, you want to ice it initially if it's just new. But if it's been around for a long time, you want to heat it. You want to drive circulation to that area. Additional therapies, if simple exercise is not responding, you want to use additional therapies like infrared light therapy. We can use injection therapy, deep tissue massage therapy. All these things can help out. Last ditch effort, if it's not working, then would be something like surgery or something like that. But ultimately, tendinopathies are typically manageable by yourself, but when it's really bad and really inflamed and you can't get out of a bad situation, then you're going to need help and need assistance with that. That's what therapy's for.